Hi, and welcome back to 90 Day Dental Day 51. So, we're in part 2 of whitening today. We started talking about an introduction to whitening yesterday, and today we're going to take that a step further and talk about the second stage. We spoke about the legalities and we spoke about the process of how whitening works. And today we're going to delve in a bit more into the actual process itself and also a couple of factors that will play a role in it. So, there are numerous systems available on the market. And actually, all of them will work in their own special way. They will all work in different ways to a certain extent. And whatever systems you've used and you've had a decent result with is the ones I would normally recommend going with. But I don't personally have a preference for system. I think different systems will achieve different results, and that's the way to assess it. There's various factors that I would talk about, and I would talk about the extent of the staining, whether it's intrinsic or extrinsic, or a combination. Also, grinding plays a role in it. And if the patient is a grinder, do they grind day or night? The extent of abrasion or dentine exposure is another one, which plays a role into what type of whitening we probably want to do, and also plays a role in sensitivity as well. And restorations present in the anterior zone will give us an indication as to whether we want to over whiten or whether we want to moderately whiten or bleach particular case. So this all forms part of what I would call the preoperative assessment. We spoke yesterday about the fact that whitening and bleaching in dentistry is by assessment only. So we've got to assess the patient's teeth before we can actually diagnose and give them a treatment option. So assessment and discussion, and these are the factors that we're going to be looking at with that. So number one, we're assessing the patient's expectation levels, which I think is really, really important. If the patient knows what level they're going to get by doing 2 weeks of home whitening, and they know what they're going to get by doing 4 weeks of home whitening with two particular different systems, for example, then you've got a much better idea of achieving the result that the patient wants and that you're looking for. There's no point saying to a patient you're going to get to a B1 shade if they're starting off on A3.5, for example, or A4, and saying to them 2 weeks of home whitening, you're going to achieve a B1 result. It's unrealistic. It's not going to happen. So we've got to gauge their expectation levels and give them a good idea of the system that they're going with and how long they're whitening for and what result they can realistically hope to achieve. Choosing the starting shade on both incisor and canine. I would always pick one incisor and one canine, upper, lower, or both. And they would be my starting levels. I can use them as a gauge just to be able to monitor the level of whitening throughout the treatment. Why do I use incisors and canines? Incisors because they're at the anteriors, they're the easiest and the most simple to spot. Canines because if there's any tooth that's going to be slightly darker, it's usually the canines. Canines by nature have a slight yellow tinge to them. So as a result of that, they do tend to be slightly darker anyway. Not in everyone, but in most people. And they're always the ones that people notice the most when it comes to darkening. So that's one of the reasons why I would always take a shade of those, because they are teeth that we definitely want to get a shade change on. Take photos of the agreed shade tabs using Vita Guide or using whatever shade match or shade guide that you're using. Take a photo. And the reason for that is because it gives you a reference right at the beginning that the patients can use to compare with later on down the line. You can save that in the notes. You've then got a starting point that you can always compare to. Consent forms is very important. So our assessment and discussion form is also our consent form, and it allows us, by going through it all, to get the patients to consent for it at the very end properly, and that's what provides proper informed consent. And impressions. So the majority of impressions for accurate whitening and bleaching trays are recommended to be metal trays and using a stable material needed for transportation if you're sending them out. And there's a couple of systems in particular that make it mandatory to use metal trays for increased accuracy, and metal trays are widely accepted as much more accurate and stable for alginate impressions. We spoke about bleaching trays, so you can make them in-house if you've got the systems and the registrations, or you can send them to the lab. You've got the option of making them gingival coverage or scalloped. Gingival coverage means they will go over the gum lines. Scalloped means they actually stop off and they're cut off at the gingival margins on each tooth. You can choose to have reservoirs, which are gaps between the tooth and the tray, or it could be a very tight fit, and there's different scenarios for when you'd have either. You can choose the position of the reservoirs for selected cases. If you've got one particular tooth that you want to over-whiten for any particular reason, you can have a reservoir on that tooth, buccally or palatally or lingually, to increase the level of whitening on that particular tooth and give it more exposure. And also gingival scoring on models for a tighter fit. It's a tactic that numerous people have advocated and used in the past. Basically, before the tray is made, you would score the gingival margins on the model itself, the stone model, which will then allow for when you're using the suck down or vacuum formed, it will give a much tighter fit on that particular area because it will go down deeper. A lot of the whitening research that we base a lot of our decisions on is Van Hayward's, and if not most of Van Hayward's research has been done on non-scalloped and non-reservoir trays. That's just more for reference. We spoke about shade matching. Shade matching is most accurately done. We're using a natural light of 5500 kelvins, which is the widely accepted mark. The one on the top left-hand side of the screen there that you can see is a true shade, which is a unit that is automated at 5500 kelvins to give you the ability to be able to use that as a reference every single time. It will give you a reference of natural light automatically every single time. And one of the things I would advise is you've got to rearrange your Vita shade guide according to true value. And what I mean by true value is these. It's a lot easier to be able to gauge the shade and compare it quickly and get your eyes adjusted to it if you've got it arranged in value. And what that is B1 all the way down to D4 in that order that we've got on the screen there. And the reason that's beneficial is because, number one, it allows you to be able to very quickly run the shade tab all the way across the teeth so you can physically see as it's getting lighter and darker, and you can take a much quicker decision on it. Lights adjust quickly, the eyes adjust quickly to shades. You've got to be able to choose a shade very, very quickly. We're going to touch slightly on marketing just to finish off for today's session, and then tomorrow we'll delve in a bit more into power whitening, and I'll go through the process of doing in-surgery whitening as well, which I think is quite relevant, and a lot of people usually ask about it. So in terms of marketing wise, you've got to select your whitening systems carefully. Choose the ones that work best for you, that you've had good results on and you feel confident with. Provide whitening for your team. It helps. If you have something to sell, make it easy for people to buy. It's all very well putting up the posters and everything else, but actually have the information ready. Be enthusiastic and confident about the results that you will get. And that's what ultimately makes the biggest difference. Your team needs to be able to publicize it and be able to talk about it. And so that's one of the biggest factors with whitening. It's a very easy treatment to do if your team feel confident in being able to sell it and treat it as well. That's the end of today. I think we've had enough of me talking about a number of these points and introducing a lot of these concepts as well. Tomorrow we're going to delve into part 3. So I look forward to speaking to you then. Have a great day, evening, and I'll catch you then. Take care.